Lockdowns may have slowed the tide of coronavirus cases, but now everywhere you look, there's talk of a new surge. The numbers of people being infected are increasing. But what if calling it a second wave is harming the fight against the virus? Welcome to Roundtable. Depending on which scientists you talk to, we're getting it wrong. Coronavirus is not about to go through a second wave. They say it's the continuation of the first wave. Does the terminology matter?
As lockdowns around the globe begin to ease, people are returning to work, children are going back to school, and restaurants and places of leisure are once again starting to fill up. With no vaccine or cure for COVID-19, there is, however, fear of a second wave of infections. But are we still really in the midst of the first wave? And is the concept of a second wave inaccurate? The World Health Organization has said the COVID-19 pandemic is currently unfolding in one big wave, with no evidence that it follows seasonal variations. Despite the WHO disputing the concept, why then is there a concern of a second wave? The issue of a second wave has been a controversial one and is often referred to by politicians and in the media. Linda Bold, Professor of Public Health at the UK's University of Edinburgh, has said, "Second wave isn't a term that we would use at the current time, as the virus hasn't gone away. What we are seeing now is essentially localised spikes or a localised return of a large number of cases." Some epidemiologists have warned that the concept of a second wave is harming the fight against the virus. Since the outbreak began earlier this year, we have seen that robust public healthcare systems and correct public behaviour can help suppress the virus. With cases still rising daily across the globe, is it time to ditch the idea of a second wave of COVID-19?
So a lot of things to discuss. Let's introduce our panel today. In London is Oksana Pyzik, an expert in infectious disease outbreaks at University College London. We also have Raywat Deonandan, epidemiologist and professor at the University of Ottawa in Canada. And in Chicago, we have Dr. Jeremy Rossman, senior lecturer in virology at the University of Kent and also president of Research Aid Networks. Good to have all of you with us. Oksana, let me start with you. What do we mean by second wave as opposed to a continuation of the first wave?
Well, according to the WHO, we are still in this first wave. The virus has not disappeared. In epidemiological terms, second wave is not a term that is frequently used. It is, however, what we've seen is regional and national variation based on what stages different countries went into lockdown, and as a result, how we were able to artificially suppress transmission. And so here in the UK, we are a bit behind other European countries, but we've seen a stark increase in the last several days that has caused concern. Sometimes this is now referred to as a spike, which might reflect that variation a little bit more accurately.
So terminology-wise, if we refer to a second wave, what we're saying is that we've beaten it and it's gone away and now it's come back, but actually that's not the case.
It's not the case. We haven't beaten it. We were able to suppress that reproduction number through extremely aggressive measures earlier in the year. So in March and April, having a full nationwide lockdown to break those chains of transmission. Now in the UK, we have reopened schools. There's a big drive to send workers back to the office. Universities have reopened. It is no surprise here that we see this resurgence of the virus and increase in the numbers, because our artificial methods of trying to keep the transmission down, our one tool is now being removed, at least in the UK context, pretty much all at once, simultaneously. And so this has led to this quick increase in addition to opening up our air bridges that allow international travel. And now we also have to think about co-infection with influenza as we go into the winter.
Right. Jeremy, you really don't like the term second wave, do you? Why not? Do you think it's actually harmful to the idea of trying to fight the COVID infection?
I completely agree here that we are not done with the first wave, and that much of this comparison and this terminology of a second wave comes from comparisons to influenza, which is not really an appropriate comparison for the COVID pandemic. And so talking about a second wave implies that we are done with the first wave. It implies that we can relax restrictions and that we are just sort of waiting for a second wave to come, when in fact, this is all a delicate balance between what restrictions and actions are we taking and what is the level of community transmission of the virus. And this is going to be a continual process and a continual balance, not a two-phase or multiple phase process. It's a continual dynamic.
What are your thoughts, Raywat? Is the idea of a second wave, is that rooted in science? Is it a helpful idea or is it unhelpful?
It's helpful and damaging at the same time, psychologically and sociologically. I'm of the opinion that what we're seeing is one big wave rolling around the world, and the way it manifests regionally gives a different picture visually in terms of how you plot the numbers. So I don't like to use the word wave. I prefer resurgence because there's nothing magical going on here. This is all driven by human behavior. So as restrictions are relaxed, people go about their business and are socializing more, and the numbers increase again. So the problem with using terms like waves, it suggests that one, there's something intrinsic about the virus that it behaves in a wave-like manner. It doesn't. This is all about human behavior. And two, as noted, it suggests that it's the first wave is over and everything's fine. And if another wave comes, it's because of something natural in the world. That's not the case at all. It's one big wave, and how we respond to it, how we behave, it dictates the shape it takes where we live.
Yeah, you mentioned that we're seeing a surge again, and of course that is something that's been experienced in many countries. We have a graph actually showing the number of cases here in the UK, and you can see a very distinctive spike, the blue line that goes up from March through to May. It starts to come down as lockdown progresses, then from mid-July it starts to rise again. And if we extrapolate that line, I mean, we don't know exactly, of course, what's going to happen, but if we extrapolate that line, you can see why people might think there's a second wave of cases, because to the layman, that's what it looks like. But Oksana, what's actually happening, as I understand it, from what you've been saying, is that because we've relaxed our really stringent measures that we've taken, like closing restaurants and closing pubs and closing schools, we artificially brought the cases down. But now, of course, those restrictions are being relaxed, so the virus has been allowed to surge again.
Yes, absolutely. And we do know that the lockdown solution is not one that's feasible forever. But once you take the pressure off the virus will resurge. So we have to learn how to coexist with this virus safely, because we do need to ensure that children get back to school. We have a global educational crisis with over 1 billion children out of school. But what our government could be encouraging is a more flexible approach, such that in order to keep schools open, some office workers can have more of a blended approach, working from home. It's interesting. Many companies are taking that approach, which hasn't lined up exactly with the government's advice to drive office workers back into the city. So the lockdown solution isn't one that is feasible for long term. However, ensuring that we are wearing face masks, that all these basic public health measures, such as hand hygiene, making sure we have more disinfectant stations available in schools and in public places, so that society can continue, so that we try to mitigate some of the harms of this virus and cooperate together. All of that will get us closer towards being able to really progress while we are waiting for a potential vaccine.
You mentioned a vaccine there. Um, Let me throw it to the gentleman. Do either of you think that a vaccine is going to make a big difference to this? Is it going to be a silver bullet? Jeremy, what do you think?
I don't think a vaccine is a silver bullet. I don't think a vaccine is something that we need to wait to act on. Yes, a vaccine can be an incredibly powerful tool that could make a very big difference in this pandemic. But public health policies and individual actions, such as wearing face coverings, hand washing, and physical distance, make a dramatic difference. And we're so effective in reducing case numbers. So we know what to do. We just need to strengthen our actions right now. If we get a vaccine and it's safe and effective, that will be an incredibly powerful addition. But it's just an addition. It doesn't take the replacement of public health policies and individual actions, which can be implemented right now.
Yeah, and I think that might be one of the problems. I don't know whether you agree with this, Raywat, that even if we get a vaccine, that might instill a false sense of security in people, that they can relax precautions because, hey, there's a vaccine.
We plan for the worst, we hope for the best. The best would be a perfect vaccine that we can deploy instantaneously with perfect efficacy and no side effects. That's not going to happen. At best, we're going to get a fairly effective vaccine, maybe the next few months. That will take several months to deploy and several weeks to mount an immune response, which means we're going to have susceptible people for a long period of time. So, public health is the art of the possible. What is it possible to do right now? Right now, it's possible to deploy all of these strategies like distancing, closing some businesses, wearing masks. These things we know work, and they're actually fairly low cost when compared to the nightmare scenario of a disastrous economy. So yes, the promise of a vaccine is tempting to hang our hopes on, but the price of that is if it doesn't come fast enough, people will be disillusioned, and suddenly we are dispossessed and disillusioned again with the power of public health. And we should not be. Public health is how we get through this, is how we navigate out of this emergency. And people need to remember that we all have a role to play in this. The vaccine will come eventually, but we have to bear down and do our jobs until then.
And I think that's one of the, just circling back to this idea of a second wave, which isn't necessarily correct, but people were very scared about the idea of coronavirus. And if you say there's a second wave, then it means that we successfully beat the first wave. So I think maybe it's something that makes people feel happier that we can beat the coronavirus. A quote from Keith Neal, Emeritus Professor in the Epidemiology of Infectious Diseases at the University of Nottingham, sums it up. He says it's become a media term. It's become a media term as well as a scientific one. What we're seeing are spikes in many countries, in Leicester in the UK and other places. Some people might call these waves, but if they do, then we're actually looking at dozens of waves. I think that there's an idea that it's quite daunting to think that we have to change the way that we're living as we go forward, that living with coronavirus is going to become the new normal. There was some talk that it's a lot like influenza, the flu, where we can maybe see a pattern emerging. Flu affects people more in winter, but that's not actually the case, is it, Oksana? That you can't compare coronavirus to flu because it isn't seasonal. It happens across all climates.
Yes, so there is no seasonal variation with flu, and also the incubation period for COVID is longer than for flu. So it makes test and trace strategies much more effective because you are able to test and identify people who are infectious and get them into quarantine before they can become super spreader events. And with flu, that window is much more narrow. Equally, we've unfortunately seen over the summer in this hot period, at least in the northern hemisphere, we haven't had any dramatic differences which we would expect to see with other viruses that are seasonal. So definitely not seasonal. What we do need, however, is a robust test and trace system up and ready that way we can bust up clusters of infections before they go on to infect wider communities, local lockdown, and then from there it can spread much faster. Once the R value starts to creep up above 1, you start to have exponential uncontrollable spread, and that's what we want to avoid. So if we
Right.
can get the individuals isolating, that prevents a lot of havoc around. But it takes the public buy-in to comply with these measures and for people to come forward and get these tests. I know certainly in the UK there has been some accessibility problems, certainly variant availability, people having to drive quite long distances to try and get it. Other countries have underreported the number of cases as well. All of this contributes to a poorer outcome in terms of responding to the local outbreaks.
Let's talk about what's driving the new surge in cases, because there's a lot of concern that it's actually being driven by young people. And I think that's a major concern at the moment, especially with schools reopening and universities reopening. Raywat, how big an issue is the number of cases in children and in teenagers?
Amongst young adults and teens, it's pretty big. And I think it's right. Most of the Northern Hemisphere and the Western world is being driven right now by that demographic. Young people have a couple of things going against them. One is that they have a more difficult time perceiving and assessing personal risk. They're the more likely ones to do dangerous things. And they have a greater need to socialize. This is when they explode as individuals and want to experience the world and all the magic of relationships and so forth. Those two things are a combination for disaster in a pandemic of a respiratory disease like this. So I really feel for young people. The danger is when this younger demographic spreads it to a more vulnerable demographic, older people and so forth, which is not to say that young people are immune or superhuman and won't have a bad experience. Many will. But it's the older people who are more likely to die and have bad results. So it's impossible to separate the young from the old. So the danger here is that if young people do not act more responsibly, they will end up hurting and possibly killing their older relatives and friends. So the messaging needs to be better targeted and more nuanced and more diverse across the board.
And Jeremy, as Raywat said, young people are less likely to suffer because of coronavirus. Do we know why that is? I mean, they're saying that a lot of children and young people are largely asymptomatic. Is that the case?
So there is still a tremendous amount that we don't understand about this virus and about this disease and why certain groups suffer from more severe disease. We've seen correlates of disease severity, but we don't fully understand the mechanism of why some people may be completely asymptomatic and some people may be incredibly severely infected. But one thing that we are beginning to understand is that even people in this young adult demographic that typically have very low rates of severe infection, low rates of hospitalization, are prone to actually getting what we're starting to call long COVID or long haul COVID, where they are suffering from protracted symptoms. Now, these weren't symptoms enough to necessarily require hospitalization, but these are long-term symptoms that are verging on a chronic illness, chronic fatigue, shortness of breath. There's a variety of different symptoms. So we need to be shifting this narrative to talk about the risk to these healthy young adults, not only for their own personal health, but for the risk that transmission poses to the vulnerable people in the community, because there is a real risk of disease transmission from this demographic.
Right. So in that case, does the fact that schools are reopening and lockdown restrictions are easing, I mean, that's a huge problem then, isn't it?
Yes, I mean, I think that this is a real concern, and this is an area that we don't have the full picture yet. But it's a really difficult area because obviously children need in-person learning. We need child support. There's a tremendous benefit to going back to in-person learning, but there's a tremendous risk here, and we don't fully understand the risk, and we need to approach this with real precaution.
I think you've hit the nail on the head that this is so new that we don't have a complete picture, do we? And the problem is we're only going to find out the picture in the days and weeks and months ahead.
Absolutely. I think that the research on this is happening in real time. So the WHO has been fantastic in sharing and working with scientists and public health specialists in order to try and get that out so that this can inform policies as much as possible. Just going back to this idea about young people, much of the conversation has been about young people asymptomatically spreading. But yes, we're learning much more about this long haul COVID and what other symptoms and long term effects could not only affect young people, but across the board. And in both absolute and relative terms, the WHO has reported that the number of young people with symptoms has actually increased from 4.5 to 15% in under 25s. And so we're seeing that this picture is continuously evolving, but nations do have to respond with what they believe is going to be the best solution for their own children and population.
What about this concept of herd immunity? We heard a lot about this in the beginning. It seems to have gone away. Raywat, is that a thing?
It's a thing. It's not a thing that we should pursue. And the reason is to get to the threshold needed for herd immunity for a disease like this, we think you need somewhere between 70 and 80% of a given population to become infected. And since the infection fatality rate is between 0.5 and 1%, that means an enormous number of people must die before we get to that threshold. And it may not even be possible because there may not be a long-term natural immunity that is conferred through infection and recovery. So it is not something I would advise anyone to pursue. Having said that, some people are pursuing it, and I wish them well. But I will say this asymptomatic thing is very important. This is an asymptomatic pandemic, which is driving much of the inability to control it and possibly the resurgence as well. Especially as the fall months are upon us, we're going to have these co-infections of asymptomatic COVID with the common cold and flu. And the symptoms associated with the common cold may actually create a greater transmission amongst the asymptomatic spreaders, because if you're sneezing and coughing because you've got a cold, you're projecting the COVID droplets that are deep in your
right,
in
and
your
you
lungs.
might not even know you've got COVID because you're mistaking it for a cold.
Chaos is upon us.
So, I mean, so it seems to me, I mean, what Oksana was saying about the need for much more robust testing, track and testing, that seems to be a no-brainer. Why is it so difficult to get that kind of mass, widespread testing off the ground?
Well, that's both a political and a scientific question. So the scientific question is we need to develop a broader, diverse set of tools for testing, rapid testing, on-site testing, more sensitive testing. The political answer is more complicated. Who's going to pay for it? Who wants to take the risk of deploying a test that may not have good specificity? But this is an opportunity for managers, administrators, and politicians to show their worth, to step up and show leadership. The scientists are doing their job. They're producing these things in the lab, and they're presenting them to be assessed. Now society and leadership needs to do their part and do the assessment and deployment.
Jeremy, do you agree that there is a gap between what the scientific community is saying and how that is being implemented by the political community?
Oh, yes. I mean, not just in the UK, but in many countries around the world, there's an active, we're hearing so many stories about an active desire to not report cases because we don't want the case numbers to go up. So there's a real balance here and a real difficulty in saying, look, we have these scientific resources, they're continually developing, and we need to be able to deploy these, but that needs financial means, that needs political will, that needs community support and involvement. It's an incredibly complex process that needs to be done a lot more and a lot more effectively.
Do you agree with that, Oksana? I suppose the fear is that politically they're so worried about the impact on the economy that perhaps they don't want to take measures which will effectively control coronavirus.
Well, again, it boils down to this very basic principle that if you test more, you find more cases, and then that will, in some instances, work against particular election agendas, etc. So, at the crux of it, we do know, however, this is how you bust up chains of transmission, and it shouldn't be a global competition in terms of who is responding best or worst to this. Again, it really does take solidarity across the world in order to help each other.
Good to speak with all of you. So, I mean, mass testing, more precautions, and stop teenagers partying. All good messages. Thank you very much indeed for joining me. Good to have you on the show. And remember, you can see more discussion and debate on our YouTube channel. Search for TRT World Roundtable. But for now, from me and all the team here, bye-bye. Thanks for watching.